Can you imagine that we're in the middle of a pandemic as I am speaking? COVID 19 has affected everyone's lives despite their race, age, and gender. As far as everyone is concerned, San Angelo has enforced new rules stating that everyone must wear a face mask, basically everywhere in public. However, having to wear a mask is more for our safety, but can it cause harm as well? Today I'm going to inform you of the positive and negative effects of wearing a face mask out in public. I am more than qualified to speak on this topic because I have done my research and I have gone to many places that require you to wear a mask, such as Walmart, H-E-B, many shopping centers, including my job. And if you're not wearing a mask, you'll be asked to leave the premises until you're able to obtain one. I will do this by informing you that by wearing a mask, it can help slow down the transmission of the virus and how the droplets from the infected host can be avoided by wearing one. Also, the effect the mask has on the virus hasn't been clearly studied to understand COVID 19. And due to the high demand of face masks, it is difficult to acquire them across the globe in many countries due to the shortages. Some people also believe that by wearing a mask has its benefits, such as preventing and slowing down the spread of COVID 19, which leads me to my first point. Wearing a mask can help prevent and slow down the transmission of COVID 19, as said in Shaki Aziz's article, stating that a face mask may offer some protection against transmission in some areas where physical distancing cannot be maintained, such as public transport, shops, and workplaces. Likewise, the CDC recommends the use of face cloth coverings to help slow down the spread of COVID 19, as said in Aubrey Allison's article. The second point I have on combating the virus is that the mask helps prevent the droplets from spreading. Face coverings reduce the spray of droplets when worn over the nose and the mouth. Wearing a medical mask is one of the prevention measures that can limit the spread of COVID 19 and certain respiratory diseases. Covering the nose prevents the virus from entering our bodies and from the virus escaping its host. On the other hand, COVID 19 is nothing but a mystery, and it's a burden for everyone to basically find a mask to cover. Basically everyone and the healthcare workers and the general public. Face masks are not as easy to acquire, and there has been several shortages across the globe in both the healthcare setting and the general public. In Selena's article, she says, production capacity is limited in many countries and there are many shortages around the globe. Therefore, how are we more than ready to bring this big spike in cases down if we're not ready to meet the needs of the people and the healthcare workers? Cincini Gomez describes in his article that both working groups and scientific societies need to establish contingency plans and optimize both material and human resources to be prepared to meet unprecedented demands. Acquiring masks has separated both of these societies due to the high demand and shortages in the medical field. The CDC estimates that approximately 89 million masks are needed each month to respond to COVID 19. Also, if you think about it, that isn't enough masks for everyone on the front lines fighting and battling to end COVID 19 in the US. Also, the effectiveness of masks and whether it really protects us from the virus hasn't been clearly studied yet. Romero Rubio and Carlos Juan describe how homemade masks and non-certified disposable masks have very low effectiveness rates compared to certified ones. Clearly, because there are various types of homemade masks, such as bandanas and face shields, which are either too thin or there's not enough coverage for the whole face, which can also be a main entrance for the virus to enter. McDonald's article about face masks answers whether it provides enough protection and which type is optimal for the general public, and who really needs to don it remains poorly understood, stating 17.1% of respondents say they either rarely wear a face mask or never wear a mask in public. But I mean, who is there to blame if there isn't enough research to really say whether face mask protects us from getting the virus? By informing you that wearing a face mask can prevent the transmission of droplets to slow down the spread of COVID 19 is still unclear, while battling to provide a face mask for everyone. I hope you now understand the positive and negative effects of wearing a face mask out in public. Will you choose to wear a face mask during this pandemic?